This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Martin. He's a board-certified plastic and reconstructive surgeon.
I'm very board-certified.
Dr. Martin, how you doing?
Good. Very good.
Good. So I feel like we're coming back from summer vacation because our last two episodes were really fun.
Right.
We had Stuff We're Into 3.0, and then we had our 100th episode, which was like the best time ever.
Right. We did a quiz show as put on by Nils. Nils was in the episode.
And a history of the podcast. So if you missed that one and you're interested in finding out why we started podcasting, seeing Nils, definitely go check that out on our YouTube channel, which is at Jason Martin MD. You can also follow us on Instagram at Beauty and Surgeon Podcast. So today's episode, we're getting back into more talking about the things that we typically talk about, which is things related to plastic surgery and beauty and all that kind of good stuff. And
this is a good episode.
Yeah, this is something I've been wanting to talk about for so long. And I really finally, I wrote this episode after, a day where we'd had quite a few people say the same thing to me. And it's something I always kind of find interesting when someone says, when we suggest a facelift or something formal, like a formal surgery to someone, and they say to me, I'm just not there yet. And, and I get that. And you want to meet people where they are. But it brings up then, the other thing that people ask us a lot is, how do people stay looking so good? And I thought, well, this would be a great way to kind of talk about both of those things, is talking about how, the name of this episode is How to Age Like a Hollywood Superstar. Because I think there's a misconception that people who age really well maybe don't do surgery, and that
right.
I think
and there's also a double-edged sword to the whole world of plastic surgery.
Yeah.
So you have it's like a duality to it. These people that are quote unquote natural in Hollywood, most of them had plastic surgery. People that run websites that are natural and sell natural products have had plastic surgery. Mm-hmm. These people that go on and sell things on the internet, or you read stories about them being natural, I'm pretty much guaranteed they've had some sort of plastic surgery. So it's not fair to people to look to them and say, hey, I wish I could age like that. What is their secret? What cream are they using? Mm-hmm. It's the cream is called plastic surgery cream.
Well, or they'll buy everything that person is selling, thinking that they're going to look like them. I mean, I think that's definitely something you see in Hollywood, is some famous actors, actresses might have product lines or websites that sell very expensive things or endorse very expensive things. And you think that doing those things will make you look like them.
And I want to be very specific. We're not talking about any specific actress or actor. I'm just saying in general, the kind of what Hollywood's like, or, in these bigger cities you see. I mean, the reality is that most of these people have plastic surgery, and they go to very expert, plastic surgeons, and they are plastic surgeons. Okay. They're not
hopefully
they are. And
you have bad examples of, I was thinking like Kanye West's mom. I mean, she went to a non-board certified doctor.
Exactly.
Bad things happen.
But there's also an underworld of plastic surgery, especially in places like Los Angeles and California, where you have this cultural
Miami
and New York, and you have this. New York's not as bad, but you have this cultural push to everyone to look youthful and young and perfect, and that can really result in things that are not really good for people, with outcomes and everything else involved in that. So I think this is actually a really interesting conversation. I know we're going to talk about it superficially, but I think the underlying kind of stuff here, I think, is really helpful for anyone who is considering doing plastic surgery in the future. Yeah.
So really, the other way you could look at this episode is how to age gracefully.
Right.
And gracefully is different for everybody. And one of the things that was really important to Dr. Martin and I is that we aren't looking to surgery shame people. So get surgery, don't get surgery, whatever. That's not what this is about. We're not going to talk about specifics of people's bad surgery. That's not us.
Yeah,
that's
we're not
what we're about.
Surgery shamers.
No. So we just want to really talk about, if you are looking to maximize your or extend your beauty, extend your aging,
Right.
make sure your aging is very subtle. These are some ways that you can do it, and also some things to definitely avoid.
And we know full well if we want to get clicks, we could just do an episode and I could literally dissect what I think they had done.
Yeah,
we
and
know that.
There's lots of that on YouTube, though. So if that's what you're looking
if
for.
we can get like computer animated avatars, maybe we'll do that in the future. What did they have done? But we're not going to do that to people because in the end, Amy and I do believe in privacy and we believe in HIPAA and we believe that people have rights, even famous Hollywood people that you don't think that they should have rights because all they do is sell their looks and likeness to make more money. But with that said, I mean, we're going to hold true to that.
Yeah. And that's their story.
That is their story. Yeah.
That's not for us to dissect.
But we will dissect a little bit.
Yeah. So let's first talk about the good. And I put this slide.
Why do you have a picture of Elon Musk?
Ageless aging. So Sarah was really awesome to choose some pictures of celebrities who have been open about the fact that they have had quote unquote work done and look amazing. I mean, these are
What did Elon Musk have done?
I don't know, actually.
Okay.
Does anybody know?
I don't know for sure, but definitely hair plugs.
Yep. Oh, he had plugs.
And yeah, you see old pictures of him. Yeah.
Yeah.
Oh,
he had
so
plugs. Yep.
Hair transplant. Okay.
Yeah, and I'd consider that a cosmetic procedure. But in this,
And Kaylee Kuko obviously had breast augmentation.
and rhinoplasty.
Rhinoplasty.
Yeah, she's
okay.
talked about her rhinoplasty. Yep. Yeah. So ageless aging. So how do you achieve ageless aging?
Is it Kelly Kuko or Kaylee Kuko?
Kaylee? I think it's Kaylee.
Kaylee or Kelly?
Yeah, it starts with a K. So the number one thing here, if
I mean,
you're,
Kaylee sounds more like an actress name. I just want to just say, I know you're trying to get something really important, but I mean, it seems like it would be Kelly, but it's probably Kaylee.
she was probably named Kelly and goes by Kaylee.
Yep.
Yeah. Nils is going to ask.
I really like her. She's like one of my favorite actors.
Nils is going to ask Dr. Google.
All right.
So there's a couple of keys. If you want to age ageless aging, the number one thing, don't fear the knife.
Right.
And I think that's what I started with, because it really kind of came up with all these women and men saying to me, like, I'm just not ready. I'm not there yet. And like, when you're in your mid 50s and saying like, I'm just not ready for a facelift, I think it's somewhat because people don't want to admit that they're aging, but at the same time, you can either admit it and address it or deny it and be bothered by it and let it keep haunting you or going with you, you know? So I get not being ready for surgery for a number of reasons. However, fearing surgery because you're afraid of looking weird is the first mistake that people make.
Right.
Thinking that you can avoid it, which some people can.
Right.
But, most of us, especially, are going to need something at some point if you want to age agelessly.
Right. So Amy and I are big proponents of people who do not want surgery. People come in here all the time. They're like, I don't want to do surgery. We love that. You be you. We support that 100%. But if your thing is that you want to look the best you possibly can, be your best self, and you want to look ageless, at some point, at some point, I'm going to have to cross that threshold and do surgery. At some point, Amy will too. Mm-hmm. So the stigma around it, I think, is unfortunate with plastic surgery because people either associate it with gaudiness or being self-centered, mm-hmm. or all the terrible examples we've seen from Hollywood of people destroying their faces, because they're chasing youth and they're doing too much. But the reality of it is, like, done thoughtfully and having a systematic approach, especially smaller little things over time.
Timing is key for subtle aging.
Timing is key for subtle aging. Is really important. And if you do that, you would end up like some of those people that we all look to, right? Mm-hmm. And I'm not going to give names because I don't know if they've had plastic surgery, but we can all think of names.
Yeah, people who just look amazing.
Yeah, like, for example, and again, we don't know if any of these people have had plastic surgery. We have no idea. But like Jennifer Aniston. The woman looks mm-hmm. amazing.
She looks amazing.
Christy Brinkley, I saw the commercial where she was walking around with a bunch of cantaloupes in France. And she's like, this is why I look so amazing.
You know why? It's because her product line, Meaningful Beauty, uses like the extract of that melon. It's not a cantaloupe, but it's some other melon.
In France with some French doctor.
Yeah, and they make this.
And there was a part of me that was like, I wish I was a French doctor because he just sounded so good. In France, they'd be like, it just sounds like us. But here I was like, it sounds the cantaloupe and to the cream, the special. And it was a cantaloupe. I remember it was a melon that does not like decay quickly.
Yeah. And so it's trying to prevent your skin from decaying.
Right.
Yeah. Yeah. So timing, I think, is the big key here. And it's different for everyone. And I think that also is something that people, like I said, associate certain types of plastic surgery with certain ages in life, but it's not the same for everyone. I mean, there are absolutely men and women, more men than women, who can wait until they're even 60s before addressing anything and really not have waited too long. And there are other people who really need to start addressing things in their late 30s.
Oh, yeah.
or even earlier.
And
in
that's a
some
lot.
cases.
That's genetically driven, and then it's lifestyle and exposures.
Yeah.
So, you could have the perfect genetics, but if you live at 10,000 feet and all you do is you're outside in a dry climate, you're going to age faster than people that, are at like sea level and, not exposed to as much sun. So it definitely depends, and vice versa. It's just, how you live, your lifestyle, if you're a smoker, if you're a drinker, all these things matter. A lot of people come in our office and they're like, I just need to reverse time. I'm like, well, we should have thought of that before you started smoking for 20 years. And okay, that's brutal honesty. And I mean, I love you, but like, let's just be honest here. You can't like put the genie back in the bottle in some cases.
Right. And I tell people that, that really, yes, good surgery can make you look younger, regain a more youthful appearance. However, the real secret to all of this comes in just slowing time, so that you just continue to look good. So 10 years from now, people are gonna be like, oh my gosh, you haven't aged a day. Well, that's because you had a facelift 10 years ago, not because you just look amazing. So there's a part of this that just, if you do surgery that's timed correctly, it's subtle. Your aging is just more subtle. It's more slowed down. You can really slow aging, but it takes.
In normal person parlance, you don't wait till your neck is a big turkey gobbler. Okay, You just wait. It's a little bit problematic, and you do this little surgery,
or until you can't see out of your eyelids,
right?
Like they're drooping over your lashes.
Yes, that's key. But I think timing is probably the most important thing, and that's why it's super important to have a relationship with a plastic surgeon, a board certified plastic surgeon that you trust, and they could be honest with you, and you can have a pro forma, a plan for the future.
You're tromping all over my last slide.
Okay, what did I say? All right, yeah. Sorry, go to the next one.
Well, one of the other things is go easy.
I should really read your slides beforehand.
Right. Well, we'll talk a lot about that in the last one. So go easy on injectables. So this is another thing that people have become really obsessed with injectables. And as more people have started doing injections, which we support. I mean, our favorite injector by far is a nurse injector who is the most skilled injector I've ever seen. She's amazing. But as more people, less board certified plastic surgeons, more other types of providers, and in some cases not providers, even estheticians now are doing filler and Botox, which is great if they're well trained. The tendency to become over-injected because it's easy. Like, hey, you're in for a facial, like, ooh, let's give you some Botox here. Let's start some filler. It can start to
It's the American way.
you.
Yeah, exactly. More is better. You are aging. I mean, volume is the answer to everything. It's not. I mean, if you just blow up your face, that doesn't look youthful, right?
And you have to keep doing it.
Right.
And the more you do it, the more you forget how you should look.
And the more it costs, you start losing how you look. And then we've all seen people that are over-injected, and even me, I think, like, what do they think in the morning when they wake up and they look in the mirror? And I feel bad for them. And I wish that they had gone to someone who, Amy, what's the most important word in plastic surgery?
No. Yeah. Then that's my knowing when to wait or say no.
No is a good word. And I think that it's really important that people think about that, and they think about having relationships with injectors and plastic surgeons that will be honest with them.
Yeah. And not losing, and those people like you were talking about, like you wake up and you look at yourself in the mirror every day. And this happens to patients who've had even really major transformations, like massive mommy makeovers. They literally forget how they looked before because just get used to how you look that day. So if you get used to yourself looking over injected, as soon as you stop looking over injected, you start feeling like you look weird, even though you don't.
I made a joke in the OR. I know this episode's not about me, but I have to relate to it. I made a joke in the OR. It would be so easy to be an orthopedic surgeon, right? Because you do something, no one ever saw it beforehand. They didn't see it afterwards. They're like, okay, you fixed it. How do you know they fixed it?
Because you can walk.
Right. With us, we're basically fixing your self-perception.
We're not.
And we're not. Nope. That's the point. Like we fix a problem, but does your self-perception realize that it's fixed or not? And a lot of people, it doesn't. And then you have to literally show them their before and afters, especially with facial surgery. And they, in most cases, are floored. Some people are crying. They're like, I never realized I looked that way, ever. And I'm like, but you came in here for me to treat those problems. So it's the whole like human psyche, our id, and how we look at ourselves and where we fit in this world and our meaning. And all of a sudden, I'm just like, Amy and I are just, hey, but we're just doing plastic surgery on you, okay? But I do think it's really important to be honest with yourself too, not just have people to be honest with you, but do you be honest with yourself?
Yeah. And then my last kind of like key to ageless aging is skin maintenance and sunscreen. Like these two things, like Dr. Martin brought up, like can't be overlooked. Like your lifestyle factors play a huge role in how you age.
Right.
And that doesn't mean that you shouldn't live your life. Like live your life. But if you really truly want to maximize your aging, taking care of your skin from the inside and the outside is very key to
We
that.
saw a patient yesterday. She's like late 50s, and she's like, I never go in the sun. She looked like she was in her 40s.
Yeah, she had gorgeous skin.
Yeah, I was like, you son of a
Gorgeous
bitch.
skin.
I know.
Yeah.
I'm seeing more and more people like that. I'm like, and I look at my lower eyelids, I'm starting to get kind of angry.
Well, let's see. That's don't fear the knife.
Well, who's going to do surgery on me? You're not going to do it. Nils definitely not going to do it. I'm not giving Nils a knife. Okay, please. You're not going anywhere near my eyelids.
Where's my?
No. Okay. Oh, yeah. Well, you got to pull it out of your things.
I'm coming for you.
No, you got to pull it out of your sleeve like we did last
Yes.
time, like this. Yeah.
I'm coming. I'm gonna make a little incision right here.
Yeah.
You won't feel it.
Oh, my God.
Tighten that right up. So
I'm going to go away somewhere and come back in like 3 episodes. I'm going to be totally youthful looking.
you were very youthful looking.
Yeah.
Yeah. So those are some of the keys. So don't fear the knife. Know your timing. Knowing when to wait. So timing is key. Going easy on injectables and really taking care of your
So
skin.
if you're listening to this and this is important to you and that you find value in this, like your timing, and you're going to say, okay, well, what's my timing? Well, that's the point of having a relationship with someone. They could actually talk to you like a real person and figure you out, figure out what you want, talk to you about your work, your job, your family requirements, your lifestyle, your goals in your life. What do you want to accomplish? These are conversations we have with people, and then we figure it out. And by the way, we set things for people and they change it because they're like, no, I don't want to do that. I'm like, great. Yeah,
No,
this
don't
is
do that.
go with your plan.
Yeah.
So I think that that's the main part of it. The thing that I tell my patients all the time, if you go into a place and you make an impulsive decision for injectables, for a product, my wife does that. She went to her hairstylist and she started buying facial products. I told her, I'm a board certified plastic surgeon that gets all these products for half price. Okay.
Yes.
What are you doing? She goes, well, she said it'll make my skin better. And I was like, what in
See,
God's name is
That's
going
what I should
on?
have put on here. Don't believe the hype.
Yeah, don't believe the hype. Yeah. So, and that's okay. And my wife is extremely educated and knowledgeable and beautiful
And
and
has
doesn't
gorgeous skin.
Yeah, doesn't even need this
Yeah.
cream that she bought.
Oh, it's just beautiful skin.
Right.
But
So,
we all want it. We all want it.
and I do it too.
Yep.
I wake up in the morning and I'm like, oh, my eyelids, what am I going to do here? I'm like, on today is the day I'm going to figure something else out or this
Have you
kind
been
of
using your LED mask?
thing. No.
Okay.
Right. So I think finding a plan that works, don't make emotional decisions, really think about timing for yourself.
Mm-hmm.
Injectables are great, but don't overdo them, right? If you're in a place that they overdo injectables, that's great. You be you, but that's not what we do.
Yeah.
So you don't want to look abnormal. You want to look demure if you're a woman. As a man, you want to look, clean and healthy, and those kind of things. Like not garish, not cartoonish.
Yeah. I have something else. I'm going to try and remember what I want to say when we get to the next,
Okay.
when we come back from our break. So this is the good. I think we've covered the good pretty well. And
It's Kaylee, by the way.
I was right.
I was
Kaylee.
right. I said Kaylee. You said no. Wait. I said Kaylee.
You said Kelly.
Kelly.
No, I said Kaylee.
Oh.
You said it was one or the other, but you thought it was sounded
No, I
more
said
like Kaylee.
I said it's definitely Kaylee.
You guys know because you listened.
Okay.
That's true.
I win again.
All right. So we're going to take a break to get a quick news from our sponsor. Let's get checked, and
Let's
we'll be
get
back in
checked.
just a moment. Dr. Martin, I'm super excited to talk about our sponsor for this podcast. Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy
Yeah.
when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly, And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right. We are back. We're going to talk about the bad. We talked about the good. We're going to talk about the bad. And this, remember, we are in no way wanting to shame anybody. So the picture's up
but
here.
There's like one of the most popular shows on TV. It's botched.
Yep.
So it's like, this is obviously interesting to people.
It is. People are fascinated, and they're fascinated because it's different, right? And we all want to know who did that to them. That is the most common question that I get asked when someone comes in and they're like, have you seen so and so? Like, who did that to them? Like, what happened there? Like, what went wrong? And I always say this, when you see someone like that, you never know where somebody's coming from. And I always try to be compassionate. You don't know what led someone down this path. You don't know what brought them to this point. So always approaching someone like with compassion and grace and you don't know. So I don't want to judge anybody. But the reason that people end up looking odd is that someone will always say yes. And what did we say before? Most powerful word in plastic surgery
No.
is no.
The second biggest problem with plastic surgery is plastic surgeons are greedy. Mm-hmm. And there's somebody out there that will take your money to do what you want.
Someone will say yes, and someone won't care. Like, you come in and want your 5th rhinoplasty in a year, they'll be like, all right.
Sure.
Sign on the dotted line.
Yeah.
Or
I got you.
And
by the way, I'm the best.
Right.
That's the other thing they're going to say.
You want 2 850 implants stacked on top of each other? Okay.
That's like all of Los Angeles. Los Angeles, they're so competitive there that everyone will jump over everyone to do the surgery. And if you say no to somebody, that is technically a failure. I mean, it's so stupid.
They'll go somewhere else. Like, you want more filler? Like, you want more of this? Like, someone will say yes to you.
Sure,
and
I'll
that
do
someone might not be a board certified plastic surgeon.
Or experienced injector or whatever. So, yeah, I mean, this is what this is all about. And you feel terrible for these people, but you also feel bad for the providers too. I think there's equal blame to go around, right?
Mm-hmm.
And we're not going to patient shame or provider shame, but like there's a problem there. And for people listening to this, you need to be an empowered consumer. I mean, that's primarily what this podcast is about, is like giving you educational information so you don't screw yourself up.
Well, and no surgery is without side effects.
Right.
Like, or complications. Like, even the most skilled, most technically skilled physician can have a postoperative complication due to a number of factors that may not even be related to the surgery itself. Someone could have postoperative hypertension issues, like a bleed, an injury. You know, there are a lot of things that can go wrong with someone who had even technically good surgery that lead them down a path of looking odd, ultimately. Even if, and that's, I always say, you can always do more. Doing too much is my next one down here. You can never go back from doing surgery. So you can always do more. So you can come back for more filler. You can come back for all these things. And people tend to want to get a lot of stuff done at once. And like, maybe that's right for you, but maybe it isn't.
Yeah, we're seeing that a lot post shutdown. People are coming out of quarantine and they want everything done. And it's been very interesting conversations. I feel like a psychiatrist. I'm like, look, okay, let's take a step back here. I know we've all been locked down. It's been difficult, but let's just really work through what we really want to do here, not just what you've been thinking about stuck in your house for a year. So, and I think that's true in all of life. People look for answers to problems they're having in their life and stuff like that. We've been really clear on this podcast. Plastic surgery doesn't make you happy. You could be happy with your results, but it's not going to make your life any happier.
You can love your results and still hate your life. So.
And still have a shitty
sad,
relationship or, or hate your job or, whatever, or, feel like you don't connect in life or something. But I do think that these examples in Hollywood of people looking really weird, and I've personally seen it when I lived in Aspen, and it's very disturbing.
And in Manhattan.
Yeah. And you wonder how this happens, but think of yourself, who's ever listening, think about this. Like, you get a little bit, right? Your whole life is based on your looks. I mean, this business you're in was all based on how you look, and you can't avoid aging. You can age well, you can look great, but you can't avoid it.
You can't stop it.
You kind of cross that threshold, and it feels like you're not going to come back into this kind of plastic surgery world that's really garish and terrible. So I think that for most of these people, even though we do have, if you're looking on the YouTube channel, the upper, whether it be left or right, I think for most of these people, I think they cross the threshold and there's really no going back in their minds. Yeah.
Or people really genuinely, I mean, there's a component of this that people do have body dysmorphic disorder. I'm not saying these people do, but I'm saying some people do. I mean, it's real and we have seen it in our practice. It's rare that we see it, but when you see it, it's really, really sad. So again, going back to someone will say yes. I mean, there are people who want outlandish things for whatever reason they want them. That's what they're asking for, and it's not normal. So there is a part of this that leads someone down this path that is not normal. So it's not like this just happens by chance or by, subtle things. Sometimes it is really people who are so distorted in the way they want to look. They want to look this way in their mind.
Right. And most of these people are going to like the top-notch plastic surgeons because they have the money. When I say top-notch, maybe that's not right. The people that have the most kind of prolific practices that are well marketed and stuff. So it's not like they're going to the worst surgeon around.
Right. So let's talk about now for the average person out there, let's put these celebrities aside. And how can you prevent yourself from having a bad outcome or a non-aesthetically pleasing outcome from surgery? Waiting too long, a big change versus a subtle change. So this is where people are like, whoa, you look like a completely different person. Well, do you? No, but you probably look like you did 10 years ago, maybe if you do a facelift when you're 65. Maybe the people who know you now didn't know you then. And we have the benefit of being in practice together for a long time. So patients have come in for their second facelift or their third.
Just did one today.
And it's amazing because we know that person from that time ago. And for us, it's like, wow, you're back. We know.
You kind of looked like you did 10 years ago when I did your first facelift.
When we met you. Yeah.
So, it's like Groundhog Day.
Yeah. To us, these changes are subtle. So, but if you do a big transformative surgery when you've probably waited past the point of being able to not be noticeable, doesn't mean that your surgery is bad, but it's going to be noticeable.
Right.
And I think that happens sometimes with people that are in the public eye. Their change is so dramatic that even though it's a good change, people, are startled by it. So then it becomes a topic of conversation. So if you don't want that to happen to you, follow my advice.
Who's the actress? She talked about it. The Dirty Dancing lady.
Jennifer Grey.
Yeah, Jennifer Grey did the rhinoplasty,
Yep,
and
and
it was
she hated
actually
it.
she had it was a really good rhinoplasty. Like they did a good job, but it completely changed her looks.
Right.
Yeah.
Because people weren't used to seeing her
No.
like that. If no one knew what she looked like before, would anyone have cared? Like, no.
I think it was kind of also that nobody puts baby in the corner.
Nobody was baby in the corner.
Yeah.
Yeah. So doing too much, then that's.
Do you think anyone got that joke that was not our age?
Well, I think the people that listen to this podcast are at least
Okay.
at least the age of seeing Dirty Dancing.
Yeah,
And
okay.
come on, if you are the age where you have a child, I mean, who would now benefit from seeing Dirty Dancing? Like, how could you not bring that into their world?
Right.
I mean, there's some things you just have
Who
to
would
share.
not want to see a movie about the Catskills, right?
Oh,
and rock and roll,
right? And a 16-year-old girl.
Yeah, and single woman having a child, and the workers versus the rich people. I mean,
Yeah.
come on, am I appealing to your
and dancing.
entertainment bone here?
I carried a watermelon. All right. Enough Dirty Dancing references.
I'm just going to also say that when I was younger, I would practice in the lake too with my dancing partners.
doing lifts in
Yeah,
the water.
doing the lifts
yeah.
in the water.
Yeah, the best place to practice lifts is in the water.
Okay, that's good.
Yes.
Sorry.
All right. Okay. So doing too much, doing too much at once is definitely going to lead to an unusual outcome. Overdoing injectables, we talked about injectables, and I think that's where people really get this distorted view and what you don't see. So let's say you go into an office and they show you a still shot of a person before and after, like, ooh, we're going to give you a liquid facelift. Great. You're like, this person looks amazing. And you know what? They are not moving. As soon as that person starts moving their face and animating, they probably look a little odd.
Yeah. So if you can't move your face, you're going to look weird.
Yeah.
If you have proportion problems, I can't say the word proportionality
Proportions.
problems on your face, meaning your lips are 2 times bigger
You
than
got a
your nose.
disproportionality?
Yeah. Then you're going to look weird.
Disproportionality disorder.
So clearly, like, slight augmentations are good, right? If you have a small face, putting a little bit of volume in there is good. But if you have a small face and you're putting a crap load of volume in there, you're just not going to look good.
Or you need a facelift and you're trying to fill that
Right.
in with filler.
And by the way, we're talking about face here, but like this can apply to any parts of the body. The face is just easier because everybody sees it. But this is true for your breasts. This is true for body contouring. This is true for body lifts and tummy tucks. There is a range of what appears from a proportionality standpoint normal, right? BBL is a good example. Everyone wants to get fat in their butts. If you have some fat in your butt, it looks pretty darn good. If you have a crap load of fat in your butt and you look like some filter from Instagram, then that's going to look weird. Maybe that's what you want. Maybe that's what you're trying to go for.
Yeah, some people are. Again.
Right. Again, but like if someone wasn't going for that and they have this big shelf on their back, then it's probably going to look a little bit uncomfortable. You're going to be uncomfortable because people are going to be staring at them like, what the hell's going on over there?
Yeah, squats, ladies. And money doesn't equal a good result.
Oh, that's
and
for sure.
That is so true. And
I
that's
can't tell you how many revisions we do and the people spend a crap load of money.
yeah. And
by the way, people that group on it doesn't equal good results either.
no, like don't group
Yeah.
on your surgery. And sometimes people have sticker shock. Like they assume that a surgery that is, maybe a $30,000 surgery in their mind, they think it's gonna be $10,000. And like, I'm sorry, that's the other thing. And I tell this to people, you will always be able to find someone who will do this surgery for less than I have quoted you. However, this price is fair and it is commensurate with the skill of the person doing it. Like I value Dr. Martin's skill above all else.
I value your skill too.
Thank you. And, you'll find someone to do this for less.
Which, by the way, when people ask how much is this going to cost, I'm like, I know I own this place, but I have no idea. And they think I'm lying. And I'm like, I really don't.
Yeah.
So,
which
is good. The surgeons shouldn't be thinking about
No.
money when they're looking at you.
No.
The whole point, the whole reason that I don't know the money is on purpose. So I'm not sitting here in some weird ethical dilemma like, oh, this, $10,000 just went out the door. Like, this is the last thing I want to think about. I want to walk in there of clear conscience, look at the person, and honestly and ethically with my expertise, tell them exactly what they need in the kind of plan that we would set up for them. That's really good plastic surgery. That's being an ethical doctor or someone who believes in the Hippocratic Oath and all that stuff, and the stuff that nobody cares about anymore.
Yeah, but and there are a lot of offices that will.
If you book it today, you get 10% off.
Right,
What are you
20% off.
like? Are you a timeshare? Like,
Yeah.
what's going on? Are we buying timeshare, or am I getting my breast augmentation?
Yeah, but it's tempting. People are like, ooh, it sounds really good, and like I can do it next week, and like, oh gosh, like,
If you take this spot for next week, we'll give you 20% off.
Yeah. So just knowing that money isn't going to equal a good result. So if you have quotes from 5 different doctors and you think that the more expensive is going to guarantee you a better result, or that the cheapest one is definitely going to be a bad result, that might not be the case. It might be, but it might not be. And if you want to know more about what goes into the price of surgery, listening to our podcast where we really break down the cost of surgery and why things cost what they do, highly recommend it, because you'll be more educated about what might be missing from your quote or what might be too excessive on your quote. You'll have a better idea of what questions to ask about money. So you can pay a lot of money and get bad surgery, and you can pay a lot of money and someone will do just about anything you ask them to.
Exactly.
Yeah. So to wrap it all up, and this is where I kind of cut you off before, Dr. Martin, I'm sorry. How to age gracefully? Like, how do you do this? Like, we've talked about good things to do. We've talked about things to avoid, but having a plan and knowing that no surgery lasts forever is number one. People will often say, oh, well, if I do this now, I will never have to do it again, because when I'm fill in the blank age, I won't care. And I guarantee you, when you get to fill in the blank age, you will care.
Right. They all do that.
Yeah. So Dr. Martin, for you, talk more about how you really set up that plan with someone who comes in and is like, look, I'm really seeing the signs of aging. How should I time stuff?
I do it just like I do with everything else and every other patient that comes in. I'm saying, let's talk about exactly what bothers you. And then let me look at you and see what I think. Let's meet in the middle of what we both think, and then set a plan of what we need to do. Always picking the lesser invasive options over the more invasive options.
Not always.
If possible, but in many cases, you have to do the more invasive option. Always considering financial investment for people. We do that no matter what your financial station is in life. We are considerate of that. And then considering what your life circumstances are, how much time you have for recovery. These are all the things that I talk about with every single person. And then make a plan. That's what I do.
Yeah.
And that plan usually involves not just the surgery now, but what you can expect in the future. 5 years from now or 10 years from now, this facelift or neck lift we're doing, we'll start to, we'll definitely loosen. You're going to start to see those signs of aging again.
Yeah. No surgery lasts forever. And depending on the type of surgery, it may last more or less time. There are definitely surgeries that kind of do. We talked about that in rhinoplasty. That's like the one surgery, rhinoplasty and tummy tuck, as long as your lifestyle pretty much remains the same, like those are things that you will likely never have to readdress. It's very rare that we do a revision tummy tuck. It's unless somebody loses weight or has a baby, has a major lifestyle factor.
That's really true. And you said rhinoplasty and certain other things I think last, otoplasty or ear tucking.
That can be. And same thing with an upper eyelid surgery. Some people time it, time it just right to where you can get like 20, 30 years out of an upper bleph if you do it at the right time.
Totally.
And even then, you may just decide you're fine with it. So there are surgeries that have a very long lifespan. There are surgeries that have a shorter lifespan, like something like a brow lift. I would say has one of the shorter lifespans of surgery just because of the nature of it, has a little bit shorter lifespan. Other things change in life. Breast augmentation we've talked about before is not permanent. Like you're going to have to, if you are fortunate enough, I always say, regardless of your age, when you're having surgery on your breast implants, you're going to have it again, even if you're 70. Like people will say that to me too, like, oh, this is the last time I'm touching these implants until I die. I'm like,
that's a common thing when people come in for breast consults and they've had previous breast augmentations. So they'd never talked to me about this. I can't believe I'm back in here. I was like, I have this conversation with every single one of my patients.
Yeah. Did you think your breasts were not going to age with the rest of your body?
I know. But you feel bad for these people because they kind of felt like they were sold a bill of goods a little bit.
Well, that or you don't think about it. When you're 25 getting your breast done, you really think I'm going to be 50 someday. You don't even think that's going to happen. So
it's be 25 again.
Yeah, those people, I get it.
Breast augmentation, yeah.
Yes. So
let's do it.
Yeah. Doing less more often, like Dr. Martin alluded to. So doing subtle things over time is going to give you a far more graceful aging than doing big things less frequently.
Right. And then the less more often things, this is where some of these technology things that we do in the office are really helpful. Body type,
bridges.
AccuTite, Face Tight. Now we just added on Beauty Fill, stuff like that. All these, that's why we brought those in, is to give people bridge procedures between more major surgeries.
Mm-hmm. Yeah. So they help fill in the gaps, and also things like skincare. That's where your skincare comes in between your major surgeries, keeping everything good. Keeping expectations in check is something we have not talked about yet on this podcast, but I feel like it's so important to bring up.
Expectations. That's definitely going to be an episode. Expectations.
We've had several. Recovery expectations.
No, just expectations.
Oh, we've talked about surgical expectations. We've also talked about recovery expectations. We've talked about expectations, but when I say keeping expectations in check, it's understanding that you're going to keep aging. gravity is continuing to pull down on the breasts that you just had lifted. It's continuing to pull down on your
Whatever
face.
large sum of money you pay me for a face and neck lift is not going to stop aging.
Nope. I wish it would. If it would, I mean, my goodness.
Even if you're Elon Musk with his hair plugs.
Yeah. So knowing that going in with eyes open and knowing that, these things are not going to last forever if you want to maintain this look. And
Right.
that's really what it comes down to is if you want your breasts to remain this high for the rest of your life, you're going to have to keep getting them lifted. How often you have to get them lifted mostly depends on your genetics.
Right.
If you want your face to keep looking this good, you're going to have to keep getting something done. So having that expectation up front, I think for people, it helps you understand that. And that's if you care, maybe you don't care.
And I think that people also think if I'm getting things done, then I end up looking like Joan Rivers, R.I.P., because I love Joan Rivers.
Yeah.
But you don't. I have patients I've done 2 to 3 facelifts on, and they look totally normal.
Totally.
You would never, ever know. I've had people I've done 2 or 3 breast surgeries. Their breasts look great. I've had people I've done liposuction on a couple times. Had people did a tummy tuck, got pregnant, did a tummy tuck again. So, it's having that relationship, that kind of pathway that's free, that takes in consideration your life and your expectations and financial restraints and all that stuff, and just formulates a plan that's smart. Mm-hmm. So, it's just a pro forma. It's basically what it is.
Yeah, have a plan.
Yeah.
And then my final thing is sunscreen. And that I group in sunscreen with all over health, like being healthy, eating a healthy diet, avoiding environmental and toxins when you can, not smoking, really just taking care of your human self is going to really help you age gracefully as well. Yeah. That's all I got on this one.
So good.
But
I think people want us to tear Hollywood apart, but we're not going to do that. So
that's not nice.
But there is so many.
It's just not nice.
There's so many examples in Hollywood of abundance and excessiveness, and the reality. And I say this all the time in consults too: is beauty is in balance. Balance is, if you look back through all of art history, Sarah will love this part of it. When you talk about the Greeks and the Romans and looking at the statues, and they're all like based on this kind of balanced Fibonacci kind of thing, it's like everything has this relationship to it. Everything in nature, if you look at Mont Saint Michel, it has the trilogy that's from Catholic past of the threes, and everything's based on threes, and you can see the proportionality of everything has this kind of third repetitious kind of thing, and it's all balanced. Like anything you see in life, but some people like abstract stuff too.
Yeah.
So it's if you are a person that really appreciates natural beauty, nature, all these kind of things, then you can still do plastic surgery and age gracefully and look like some of these people you see in the magazines and the movies. But you have to be really smart. You have to go to people that are considerate, that care, are ethical, technically really, really good, and you're going to have to pay money for that, unfortunately. And that are willing to work with you over the long term, not just, hey, this person's in my office, I'm going to get as much money out of them, see you later. So that's the way I look at it. And those people do that. And I'm sure they have relationships with those people and they call them up all the time. Hey, I got a question about this, or, that kind of stuff. So,
yeah. So more than anything, whether or not you decide to do surgery is really a personal choice, and, that's up to you. But not being afraid to make that leap into surgery, I think, is something I would like for people to feel comfortable.
So basically, how to age like a Hollywood starlet is
superstar.
Basically don't be afraid of surgery.
Yeah.
That's basically what this
and have a
episode's
plan.
about.
Yeah,
Which is so true. It's literally true.
Yeah,
I know it sounds, kind of trite, but it's true.
Well, but to drop some of the scariness about surgery too, the people who look amazing, for the most part, have had surgery a number of times and still look amazing. And look at those people and feel happy that you have the choice, and that we have, it's going back to Ryan Doris and the triangle or the pyramid. Even that we can have these conversations about these things really shows that we are blessed and we are fortunate, to be able to actually.
Yeah, it's definitely an American problem. Yeah.
Well, that was just, it's a human problem. It's not just America. In fact, there are other countries who do far more plastic surgery than Americans.
Korea.
So it's not America.
Korea, Brazil. Yeah.
Yep. Even France. A lot of these.
Venezuela.
It's far more surgery per capita than Americans. So
we need to get on the surgery train. Okay.
But
that should be the next episode. Everyone needs plastic surgery, and this is why.
Well, that's kind of what we just did say.
I know, but we didn't really.
But thank you, everyone, so much for listening. You are beautiful and amazing just how you are, and we appreciate your beauty.
And you don't need surgery to have value and to look beautiful. But if you want to age gracefully.
You do. So if you've listened to this podcast and you are interested in watching it, we didn't have a whole lot of interesting slides, but there's always us to look at.
Yeah. We'll get back at it next. The next one we'll do something super plastic surgery.
Well, this was all about plastic
Yeah, that's
surgery.
true. That's a good point.
Yeah. We do appreciate you listening and watching. If you leave us a comment, a rating, a review, we really do appreciate that. And if you would like to send me a text or a voicemail, I didn't even see it now. Now people are just going to be texting me all the time. And I really like voicemails because I like hearing people's voices. I'm
Yeah,
a
I do
people
too.
person.
Me too.
So you can call us. You can leave us a voicemail. You can send us a text at 303. The number is here. 630-9038. We appreciate everyone so much for listening and hope you join us again next time.
Yeah. Thank you so much.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.